Hey, Dr. C here again. Going to have a little different take on things for a couple of sessions now. We're going to talk about a very common problem that does require a lot of exercise and stretching and strengthening. The most common problem that people have is with back pain. Back pain. It's estimated that roughly 80% of people, by the time they get to be their seniors, have back pain at one point in their life for a variety of reasons. And so this is part of the treatment plan. So what I'm going to do, I'm going to describe a little bit about back pain, and then we're going to go through some of the exercises that are used specifically for certain types of back pain. Now that means that you need to understand a little bit first about the back. It's a big area, let's face it. It goes all the way from the head all the way down, including the pelvis, all the way to the end of the pelvis, almost to the legs. It's a big area, a lot of tissues. What type of tissues will cause probable pain? Well, first let's talk about the anatomy. First of all, the bone anatomy. 33 different vertebrae, 33. Some of them down the bottom, like the coccyx, the tailbone, and the sacrum, they're fused. They're fused. The rest of them, like the lumbar, the thoracic, the cervical and all, those have some motion to them. And so there's 33 different bones, that all of which could have a problem. Fortunately, not all at the same time, but you understand, I'm sure. On top of that, there's a number of muscles that are attached to those bones. And they come in different layers. There's a superficial layer, like say the latissimus, the trapezius, rhomboids, all the superficial muscles. Those are present. Then there's intermediate muscles. In other words, you got 3 layers at least. Intermediate muscles, and then you have the deeper muscles. The deeper muscles are the ones that we're really concerned about with the low back area. So we'll be dealing with very specific muscles to exercise them and to stretch them and strengthen them. Okay? So you got the bones, you got the muscles. What types of problems do we see with the bones? Well, not good. Not good. Usually with the bones, it's related to trauma, or maybe you have thin bones like osteoporosis. You may develop fractures of the vertebrae, compression fractures, very painful, or trauma, one or the other. Or you may, if you're really unfortunate, you may get cancer that spreads to the bone and causes pain. What causes muscle pain? Well, muscle pain is usually due to something you've done. And you can usually relate that pain to a specific thing you did the day before. Now, that pain may be very specific, located in one area. That's a lot easier to treat in many instances. Or it may be a generalized low back pain, possibly even a mid-back pain, or a cervical pain, a neck pain. Could be any of those areas. Why those areas? Because there's motion at those areas. So that's why they're a little more prone to get into the diseases or whatever you call them. I guess we could just call them the trauma and all, to any of those different areas, 3 areas of the spine. Okay, so now you've got bone, muscle. The bones themselves have a nice curve. The top part of the vertebrae up here, they bulge out just a little bit. Nice little gentle C curve. And then to compensate for that, there's a gentle C curve that goes inward, down below. So over and then in. You try to keep them nice and straight. If they're not straight, you may have scoliosis. We're not going to deal with that issue. Not going to deal with that. But so there's a curve that we have to deal with. Now all of these vertebrae line up and they attach to each other. What helps them to stabilize are ligaments. And you can sprain a ligament as well. Now those ligaments can go all the way up and down the whole spine, or they may be intervertebral type ligaments. Finally, the bones themselves have little edges to them where they connect one to the other. And they're called facets. And the facets can also get arthritis and get other problems as well. Another part of the anatomy that causes the pain are the nerves. Specifically in the low back, the sciatic nerve. Sciatic nerve is a big nerve, biggest nerve in the body. And it comes out of little what they call foramina, little holes that allow the nerves to come through from the spinal column all the way out and then go down into the legs, specifically with the sciatic nerve. Now the sciatic nerve is composed of 5 different nerves that have come out at 5 different locations, the lower lumbar and the sacral, and they all congeal together and go down into the legs. Now pressure can be put on those nerves either where they come out of the vertebrae or anywhere along the line, Now, depending on the symptoms that you're having, they can either cause what they call sensory, feeling symptoms. In other words, numbness, tingling, feeling type, or maybe just totally numb. Or it could be what they call motor symptoms. You can't move a muscle, it's very weak. Or at the worst, if there's no nerve sensation, it's a dead muscle. You just can't move it. So there's different gradations of sensation and motor. They all come in through that sciatic nerve. We have to deal with that sometimes. Okay. And now what else? Well, specifically now in the low back area, we have several important muscles that may cause very specific pain. Pain in one location only. One location. Some of these muscles we talked about when we dealt with the buttock. You know, the gluteal muscles, those 3 gluteal muscles. They're very important for stabilizing, remember, stabilizing the pelvis, stabilizing the low back, stabilizing your ability to walk correctly. And they fire during motion. So we're going to deal with specific problems with the gluteal muscle. Also, we're going to deal with the quadratus lumborum muscle. Now, the gluteal muscles move the hips. They generally, the gluteus maximus rotates out and abducts. That's its purpose. And it maintains the shape back there as well. It's a very strong muscle, gluteus maximus. And that's the one that shows the shape. Then there's the gluteus medius. That abducts, moves the hips out, and rotates them in and out a little. That's the medius. And then there's the minimus. Now the minimus muscle will also do some adduction and abduction, and it also, excuse me, will rotate a little. It rotates inward. Now, why am I telling you what they do? Well, remember, when we exercise we generally first stretch the muscle and then strengthen it. So when we do the exercises, and we will do them, I'll show you how to stretch each individual muscle depending on what they do, their function, and then we'll do some strengthening exercises for each of the gluteals. Now, what about that quadratus lumborum? What does that do? That's also a stabilizer. And it gets the name because quadratus is a square, and lumborum basically just refers to the loin. So it's a square loin, basically. It's a big muscle, and on both sides, and it stabilizes the side and back of the lower abdomen because they come from the ribs all the way down to the pelvis. So it stabilizes that whole area. It does also do some extension as well. And so a lot of the exercises that we do to stretch, we're going to flex, just the opposite, stretch it by flexing and strengthening by extending. And then finally, we need to talk about the piriformis muscle. That has a lot to do with that sciatic nerve. The sciatic nerve, as it comes out of the vertebrae and all, that goes through the notch, and then crosses over or under the pyramidalis muscle. That pyramidalis muscle. Sometimes, if you're really unlucky, it goes right through the damn thing as well. So that's why that sciatic nerve is very specifically or intimately involved with problems of the piriformis muscle. So what does the piriformis muscle do? That externally rotates the hips and has a little abduction as well. So rotate out and abduct. So to stretch, you do the opposite, and to strengthen, you do that particular motion. Okay, enough about anatomy and all. Remember that 80% of us have back pain through our lives at some point. And that back pain itself is the second most common reason for disability in this country. Back pain. Second one for disability. Over 6 million people have disability from back pain. So that's a big chunk of money. They estimated last year over $50 billion spent on treating back pain and giving out disability money as a result of it. So it's not a small issue, it's a big issue. Okay, let's talk about our exercises. And the way I'm going to present the exercises to you, we're going to do them in different sequences. Since I'm sitting, I'm going to do the sitting sequence first. And I apologize, I am using my cheat sheet in order to get the majority of these exercises in so you can see them. As we get older, we can't retain as well, unfortunately, so we got to use our cheat sheet. So what do we do when we're sitting? Well, first of all, remember, and we generally will use a lot of the sitting exercises for the simple back muscle strains. Simple back muscle strain. That's the most common. Simple strain. You can usually relate it to something you lifted or some way you twisted or whatever, but the back strain. So simple, feet hip width apart, good posture, arms up in the air, and now we're going to stretch that low back. Stretch it down, nice and slow. Once you get down, you take a big breath in through your nose, out through your mouth. and then slowly back up. And you should do 5 of those as a minimum. All the way up, all the way down. Hold it for about 5 seconds. Big breath in and out, and back up. Second thing you can do, side to side. Usually what I do is this one arm down, the other arm stretches over, and you hold it. And then you take a big breath in and out. And then back. Then you do the other side. Over. Big breath in. And out. And then the third thing you do for that low back area, in the sitting position now, is a simple twist. So, put one hand onto your chair, bring the other arm, twist that around. Twist, twist. And then to do the opposite side, one arm down, other arm over, big breath in, and out. So you got all 3 of those. Now you can do more effective things with the twists as well. Arms to the side of the head, bringing the right elbow down to the left knee. Left elbow to the right knee. So that's a very good exercise. And down. Now what about the stretching part? Well, if it's for upper back, we do the eagle. You remember the eagle, the arms come out right under left, down with the arms, and then we take our right foot, slide it in back of the left, and we have the eagle. And then to do the other side, you do just the opposite. This time it's left under right, cross the left, around the back of the right, and the eagle. That, you'll feel that stretch. You will feel that stretch in the back. Okay, so those are the main things that we do. So now let's go ahead and we'll do it in a standing position. Let's do it. Okay, first of all, standing, we're going to do a series of squats and lunges. Squats and lunges. Okay, you know what the squats are. Feet go back out a little bit, hands across the chest, and you squat. 1, 2, 3, 4, 5. So we're bending the knees, keeping nice and straight. Keep your body nice and straight, and you try to get a nice right angle to the knees. So that's your basic squat. Now, as far as the lunges go, there's a couple of different lunges that I like to do. One will be simple. That is putting 1 foot forward and 1 foot back. And you're going to bend that front. So again, the knee is right over the ankle. And you're going to then bend the back knee. 1, 2. You can add your hands to it too. So 1, 2, 3, 4, 5. Another way you can do those, and of course you can do the other side as well. And another way you can do it is a curtsy. Now you've seen curtsies done before, and you start out with the same position, but now that back foot is going to cross to the other side, right in back of that front leg. Curtsy, curtsy. See that? Curtsy. 4, 5. And if you want to add your arms to that as well, that's fine. So the old curtsy lunge. What else can we do? Well, we can do, for the upper back, you get yourself a doorway, hands up to the side, hands on the sides of the door jamb on each side, and push it forward. What that does is that it stretches the muscle in the front and then strengthens the back. That's what you want to do. Remember, we had that talk on posture? That's the exercise you need to do. Now, if you really want to get into it, you can do what we call planks. How do we do planks? Arms come up. We bend it over and walk it out. That's a plank. And then you can either do push-ups, if you can do it, or you can do whatever. You can put one leg out and then push up, just like that. So planks are very, very good to do for strengthening in that back. Okay, let's go on. Let's do our kneeling pose. Kneeling pose. We're going to kneel, and you're going to do, remember, these are for either side, so you're going to do both sides. And a leg goes out. Arms come up. And we're going to stretch it over to that side. Now, why did we do that? We're stretching not only that piriformis muscle, but we're also stretching the quadratus lumborum. Okay, so that's the kneeling position. So now, we're going to do some supine and prone. First of all, we'll do the prone first. Let's do the prone. And, okay, we're going to get down on our belly and just put the arms out. They call this a sphinx, and you can see why. The other thing that you can do, and you see what it's doing? Extending the back. That's what the extension. You're stretching that low back. Excellent for that low back. Now, what we can do is a half cobra. Notice that the elbows are still bent. Or we can do a full cobra. That really extends that back. And down. What else? We are still on the prone now. Oh, yes. Leg extension. We're going to do that as well. Other good extensions. You can simply straighten that leg out and lift it. 2, 3, 4, 5. And then the other side. 1, 2, 3, 4, 5. And then, one I love, swimming. Out with the arms and swim. Very good exercise. Okay, let's go on. Let's do our 4 points. The points are 2 knees, 2 hands. Okay, let's do it. First, simple cat dog. Push that back out. Pull it in. Push it out. Pull it in. Okay, do 5 of those. Next, I'm going to put that left leg out and right arm out. This is called a bird dog. Very good back exercise, bird dog. Then if you want to add to that, you touch that elbow to the knee. Elbow to knee. Elbow to knee. And then you can do the other side as well. So that is the bird dog. What else can we do with those 4 points? Oh, one especially good for the gluteus medius. Oh, you'll like this one. You'll like this one. This is called a fire hydrant. Now, why the heck are they calling it the fire hydrant? Well, because what does a dog do? Hit the fire hydrant, right? 1, 2, 3, 4, 5. That is an excellent exercise for the gluteus medius. Okay, now let's do some supine now. Well, let's get on our back. Okay. Boy, I may like this, you know, I don't mind the back at all. So, first of all, one that I love to do, because I like to challenge everybody, get the legs in the air, arms in the air, and this is called the boat pose. Boat pose. Nice and steady. And you can feel the tightness of the glutes, the tightness of the back, and the abs. Now you can add to that and do the 100, right? Just like we do with our exercises. What else can we do? Well, an excellent one is what's called a glute bridge. Feet are hip width apart, hands down to the mat, and we lift the butt up. This is called a bridge. Now you can do a bridge like this, hold it for 5 seconds and then down, and then just repeat it. And down. Then you can add to it. Cross a leg over, raise it up, and down. Raise it up, and down. Now a good piriformis stretch is simply pushing on the knee, pushing it out, push it out, push it out. You can feel that stretch when you push it out. And then finally, pull the knees in. Knees then go to the left, go to the right, all the way down. Go to the left, and go to the right. And you should do a series of 10 of those. Okay, I'm sorry we ran out of time. We went through most of the exercises, and I hope that you can do some of those if you do get that darn back pain. This is Dr. C. Have a great day.